Culture Challenge, Patient Care, Jacqueline Jones, MSN 564. When has culture been a factor in the care of patients? First, let's look at culture. Culture refers to the behavior patterns, beliefs, art, and all other products of human work and thought as expressed in a particular community. My Hispanic population has a strong language barrier. When I call a Hispanic diabetic patient, they will let the family member who answers the phone speak on their behalf, even if it's a child. And if it's a child, I usually, of course, identify myself, but tell the person on the phone that I'm going to be calling back with the interpreter. And I usually reach out to an interpreter that's contracted through my company because diabetes is a chronic nature underscores the importance of self-management, education that promotes behavior skills that are necessary to optimize quality of life. Diabetic educators recognize that most of the effective approach to patients' education is individualized to the need of each person with diabetes. Educators likewise recognize that the way a person learns and how information is utilized depends heavily on prior life experiences and support networks, that each element is shaped by culture. And awareness of how culture impacts the health, awareness of the need for culture sensitivity is the first step toward providing sensitive and competent diabetes education. Is more than a definite knowledge of culture, values, beliefs, customs, language, thoughts, and actions. The need to gain relevant insight necessitates the need to develop a certain amount of culture humility. This will help develop a mutually respectful and positive relationship among patients and healthcare providers. The more engaged the individuals with diabetes and the support members are involved in the healthcare, the more likely they are to achieve desired outcome and improve the quality of life. Was I aware of the influence of culture in the care of the patient at the time? Yes, it was surface awareness of the influence of culture with caring for Hispanic patients. When working with a large, diverse population, health practitioners often view patients' culture as a barrier to care. Inverting this problem by viewing the barriers as arising from the culture of biomedicine provides greater direction for practice. My patient culture population, who I spend extra time with, is the Hispanics, the Afro-American, the African Americans, the Asians, and the Native Americans. When I started on my job as a diabetic care manager 3 years ago, my knowledge to building a rapport with multicultural patients was limited because I came from the hospital, so patients only stayed there back in those days 1 to 3 days. So by the time you teach the patient little by little, per shift, they're not, but it's never with the same consistent person. So that could be a challenge too, especially if someone has a language barrier. Did I become aware of the influence of culture after I cared for the patient following a reflective moment? I felt the Hispanic population that carried a strong language barrier avoided my cause more than the three groups, the African Americans, the Asian, and the Native Americans, because of the language barrier. And also, I talked to some patients and they felt like they're being judged if they can't understand what you're saying. And so I never want anyone to feel like I'm judging them. So I always try to reach out to them and give them the extra TLC that they might need. When I tried contacting the patient by phone, she did not return my phone call after 3 tries. I sent her a letter and finally she did contact. Was there a specific event that brought about awareness? When patients do not check their blood sugars, their reply is it hurts, so I do not check my blood sugar. And sometimes it's because people are afraid of needles, or they are they just checking their blood sugars improperly and avoiding contact for fear that they were going to be judged or scorned by me. And one-on-one with patient teaching helps to eliminate the fear of needles, starting insulin, and checking blood sugars. And usually time once you get them to check it that one time and you show them the proper way to do it, then they feel much better about it, because most of the time they were doing it wrong. I always like to use a certified translator in person if there's one in the building. If not, we have like a video, a live video translator that I could call and she could see me and the patient and we communicate that way. Was there a conversation about patient's life and priorities incorporated in this experience? Range of culture related health belief. Culture can be identified as one's worldview, which includes experiences, expressions, symbols, material, customs, behavior, moral values, attitudes, and beliefs created by communicated among individuals and passed down from generation as a cultural tradition. The patient's life concerns were family history of immediate family members having diabetes and dying from the complications. Patients express their fears, and that is why they avoid contacting me or responding to my calls. And cultural competency is knowledge and ability to work with culturally diverse populations, irrespective of language, customs, behavior, values, communication, action of patients, according to the race and ethnicity. How is your own culture or spiritual related to the experience? In African American population, I feel we identify when it comes to avoiding reality instead of understanding the disease. It just means that we need to just educate the population, the community, and communication and the relationship between patients and healthcare providers are key to providing quality care. Trust and interpersonal comfort is a critical component of the relationship between person who is ill and the healer. What was learned from the experience? Educators can better serve their Hispanic population when they learn the culture and accommodate culture, heritage, traditional ways of interacting with the healthcare providers, encourage patients to ask questions, picture illustration, and return demonstration, keep Spanish literature available, offer diabetes classes taught in Spanish, give patients my business card to contact me during work hours. And what was the confirm from the experience? The patient was comfortable and very appreciative that she had the opportunity to sit with me one-on-one, and I used a live video interpreter unless the patient brings their own interpreter. I do not use minor children. We developed a rapport, and I felt the relationship was open and honest way. I learned a lot about Hispanic culture and beliefs. Patient is eager to learn more about diabetes because they fear diabetes and complications. I do a 1 week follow-up call. I use eye contact. I acknowledge their personal space. And Hispanics are religious. They pray a lot. They believe in divine healing. They see disease as a curse. Overcoming the cultural barriers. A key element to overcoming cultural barriers during clinical patient interaction is the use of effective communication. This must be considered with populations with low literacy, limited English proficiency, and non-English speakers. When teaching patients with low literacy and limited English proficiency, education materials should be tailored according to that individual's level of understanding and learning. Thank you.